Welcome back, everyone, to Radiant Resilience. I'm so excited for this conversation today. I have with me Tara Harding, back from her first episode on here was episode 55, which we just figured out was about a year ago is when it came out. So we probably recorded it before that. So if you want to hear the beginning of her story, go back and re-listen to episode 55. I also did a re-release of it recently, so you don't have to scroll back too far for it. But welcome, Tara. How are you?
Thanks for having me. I am good. I am good. I am
Yes.
excited to update on all the
Yeah.
things.
Yeah. So Tara and I was trying to think of how we met again. I just,
Instagram, of course. Like that's
yeah,
where all my true friends actually are hanging on Instagram.
yeah.
I've never got to hug you guys in person, but I feel like we're closer than my people who I see in person.
I was trying to think though. I feel like someone sent me your direction. Was it
Yeah,
Lisa White?
probably Lisa. Oh yeah, for sure. Probably Lisa White. Yeah.
Yeah, I think that's who it was. So she sent me in Tara's direction. So explain kind of what you do, because I'm always like, I don't know. She has something to do with women's health and infertility.
That's such a great question because when I first met you, I was like strict fertility. So essentially, what I've turned into and my business has turned into is women who are not getting answers in the healthcare space finally get a full workup. They get answers, they get the root cause, and they feel better fast. Like we find what has been going on this whole time that traditional or there maybe a healthcare provider has just overlooked, dismissed, medically gaslit. I did start with strict fertility. I have a solid fertility program, I guess you could call it, in our practice. And that's because of all I've went through. But we've really morphed into like endometriosis, PCOS, perimenopause, menopause, thyroid, like you name it. And we even take care of men, mental health, pediatrics. We've turned into like a full scope private practice. But it's essentially those that are looking for a different way to do healthcare. And so we've really kind of flipped what their visits look like, how long they are, what they all involve, how we talk to patients, how we communicate with our patients has really just evolved in the healthcare space in general. We've really been able to change that for the better for patients.
Yeah, I love that. And I love how passionate you are. I mean, I've been watching you for a long time.
Long
I mean, we
2022, probably. Like it probably goes back to then.
Yeah, because I did my last embryo transfer 2.5 years ago. And I remember you helped me with one of
Like
my turkey rounds that I did.
before
That
that.
was
Yes.
way before
Way
that.
before that. Yes. Yep.
So, yeah, so it's been fun to watch you. And I do like truly anybody out there listening that is especially females that are listening that are struggling with any of this stuff, like Tara is the place to go. Now, do you just do in person or do you do virtual too?
Great question. We do virtual in 7 states and growing. We'll have up to 10 pretty soon. The other unique thing about us that is unique, we take insurance, most major insurances. Practices like ours typically are cash pay. We live in the Midwest. That's where we're based out of. We serve more than the Midwest now, but like people work for their insurance. And I've tried to find ways to make that be a possibility and receive this really high level style of healthcare too. So yes, we are in Colorado, Arizona, Idaho, Montana, Minnesota, South Dakota, North Dakota, Illinois, and more. So like we're
Amazing.
growing. We're
Yeah.
growing.
Yeah. Okay. So last time we talked, I think you had just finished having surgery for endometriosis. You went to Utah for that, correct?
Idaho. Yes, Idaho. Yep.
Okay.
Yep. Yeah.
So, and that was a brutal surgery. I remember, I think you got diagnosed, was it stage 4 or?
And
Yeah.
adenomyosis. Yes. All of
And
it.
they did diagnose
Yes.
adenomyosis. They can do that now?
So yeah, a true excision surgeon will be able to look at what the color and texture and makeup of your uterus is when they're in there and be like, it looks like adenomyosis. So a true one can look at it, of course, until you take it out, remove it, send
Right.
it to pathology. You won't have that definitive, but a very good trained endo expert will be able to be like, yeah, that's a disaster in there. Like that's adeno.
Yeah. So you had both
So I
from
have
them.
both, yeah. And
Mm.
he couldn't get all of mine. So long
Mm.
story short, essentially been told unexplained infertility, heavy painful periods, did IVF, all the things got worse. I mean, I bled at 32 weeks, pregnant, recovery from a C-section was horrendous. My cycles were not even humane, after that. Everything just got worse. And found this surgeon finally in my journey. And it was, stage 4. He couldn't even remove it all because it's like, webbed into my
Mm,
right ovary, my right tube. He got what we could, and things are much better since then. But I know I still have endo that was unable to be removed due to how long it was in there, how extensive it was, being missed and dismissed by a previous healthcare team, and the adeno stays. So the journey kind of started to just working on inflammation and endo protocols and things like that before doing fertility again too, since we last talked, and doing IVF again. Failing
yeah.
IVF a year ago, so
Mm,
May would have been about a year when we did IVF, failed at 0 embryos, and it basically was chalked up to endometriosis still being the issue. So I've really brought, even since then, more things into our practice and essentially using myself. I say I'm using my body as an experiment at this point. Peptides, PRP, looking into stem cells, exosomes, like all of the things, like what is out there, what can I do, researching my options, and then do I need to have surgery again? Because that just came up actually in the last month. I was
mm,
having some pelvic pain that was getting worse during ovulation again, and there is endo on both my ovaries. So I'm actually looking into what options are available from a stem cell standpoint, my own or actual stem cells, and deciding which road I'm going to go down. And they believe, there's research coming and there's actual studies being done on the stem cells, your own or others, and injecting that into the ovaries and it healing endo essentially too.
mm.
So I'm
Wow.
looking to go down that road with myself instead of
Um,
another surgery at this point.
Yeah. I mean, I think you have such a unique perspective, which I think is really cool because I think that's what's missing in a lot of the infertility world, medical
Yes.
world, is the compassion, which I've had that conversation with a lot of people. I mean, the doctors mostly, unfortunately, are male.
Yep.
and
Yep.
and I don't want to bash any male doctors out
Yep.
there because I do think if they have a passion for it, they can help females or whatever, but they really just don't get it. And
They don't get it.
and then I had like nurses who just pop babies out like crazy. And there's just like, they would talk about their grandkids, their baby, like while they're drawing my blood, while I'm going through infertility. And so I think,
Changed all of that. Yep.
I'm so
Yep.
sorry that you're going through all of this, but also like I think it really gives you a unique perspective in what you're doing with your clinic too.
Yeah,
So,
absolutely. I think I've been at a point where I've got to myself, we'll say mentally, where I can be like, okay, man, like this sucks, but what can I learn from it? And what can I do to change? Like, what can I use this story and journey for to help change it for so many others? And what are some, I'm one of those people that lives in the like Eastern and Western can meet, or like, I don't need a 50,000 person study to like say, hey, there might be something here that works. Is it going to hurt me if I try it? No. Then I'm going to do it. Like I'm looking at my rapamycin bottle here. This is totally off label, but there's, some research and studies and thoughts that like taking rapamycin once a week could help with inflammation in the body and with egg quality. Well, what are the side effects? Okay. Those are very minimal. Gonna try it. Like why not? I'm
yeah,
putting myself too in the position of, hey, I tell our patients like this is off label, hasn't been a lot of studies in it, but I'm doing it. If it's something you want to try or look into, here's what we know about it, educating them on it, but give options, especially in the
yeah.
infertility space. If we have to sit and wait for research in women's health in general, we're gonna all be 80 by the time anything changes. What are the let's look at the risks and benefits of trying something that's off label and let's talk about it and make an informed decision together and let you, the patient, decide. That's like another
Yeah,
big thing is we let the patient decide and we open their options up to so many things that traditional medicine would scoff at. And
yeah.
that there's a space for Eastern and Western, there's a space for off label, and we kind of just bring that together too and let the patient truly decide what they want to do with their body.
Yeah, which is so important because it's so hard to make those decisions too. Like, I
Mhm.
don't know if I don't know if you know any of this stuff, but I just recently was told by a primary care that I was in perimenopause, and I think all he looked at was my FSH. I think that's
That's
and he
not
looked at
no.
it on cycle day 12, which was like or 14 or something like that. It was like
Yeah.
right around ovulation when it spikes normally,
Yeah.
and and
So
yeah.
much red flags in this conversation already.
So I went to go get a second opinion from like a hormone
Yeah.
clinic. And of course, this hormone clinic, their main thing that they do is the testosterone injections. And I just thought, I mean, I don't want to accuse this place of like frauding my blood work, but also like it was ironic that the only thing that came back that was off was my testosterone.
Oh, no, there's
And
so much more.
yeah. And so then I was like, okay, well, they're like pushing, well, you need testosterone, but everything else looked fine. And they're like, well, I don't think you're in perimenopause, blah, blah, blah. Cause I'm only 38 years old.
God, you got
How old are you?
whiplash. I'm 40. Like,
Yeah.
yeah, you got
So
whiplash in this conversation.
I thought that I was like, yeah, I mean, and with my infertility history, being told that I was in perimenopause at 38, like, I'm like, wait, what? Hold the phone.
Yeah. Yeah. You're like,
This
I'm
has
sorry.
so much more emotions than, you know,
Yes.
just, oh, you're in
Literally going
perimenopause.
and being told she's in perimenopause is like a whole different than when you've been through what
Yeah.
you've been through.
So I just finally, I mean, everybody was pushing. My primary care was pushing for birth control. This other
Perfect.
place was pushing for $300 a month in
Ooh.
testosterone shots.
Ooh.
And
Like
yeah.
$45 for a vial at most places. Like,
Mm. All right. Well, I'm making my appointment with Tara.
yeah, I was like, hey, you're in Colorado. Like, Morgan can see you. Like,
Yeah.
you're fine.
But it was just an example of like, I really
Yeah.
started doing my own research and I knew a lot about the hormone space after infertility. And I was just like, you know what? I am not having the debilitating symptoms that goes along with all of these things that people are telling me. So like, until then, I think I'm just going to like sit in this space that I'm in currently.
Right. And that, we are my team, what I would truly call them hormone experts, but they're full body assessment experts.
Mm-hmm.
There's so much, we love testosterone, but that's like a piece of the puzzle, right? That's
Right.
not the full puzzle. And, I think there's the thyroid's missing in that. Ferritin and iron deficiency is missing in that. Like looking at you as a whole, like head to toe, how's your hair? Hair loss is such a common topic. Oh, yeah, hairdresser alert. Like,
I
you will
mean,
know.
I
Like,
loved your post that you did on hair extensions
yeah,
because it's such a problem right
hair
now.
extensions, everyone. Like, no
I
shame. I'm
mean,
talking about it more. Talking
same.
about it more.
Send all your Colorado people to me.
Yes, go get the hair extensions, and we'll also fix why you need them too. It's like how I kind
Yes.
of say it.
Yes, but I mean, I work with a lot of women in that perimenopause space.
Yes.
And then that plus the GLP-1s right now,
Oh, yeah.
the hair loss is intense. It's the
Yep.
worst I've ever seen it in 20 plus years of doing hair.
Yes. So I can even speak to that a little bit if you want to go down that road.
Yeah.
So it's not the GLP. I don't want the people to stop doing the GLP. I need everyone to eat more protein.
Mhm.
None of you are even close to getting your daily amount in. What happens is when we have weight loss of any sort,
Mhm.
we have hair loss. But with the GLPs, it's really accelerated for many.
Yep.
And if we all know, like the amount and our suppression and our desire to eat goes down, so our nutrients in general go down, our protein in general goes down, and that's when the body it's diverting its efforts away from the hair shaft, and it's like going to other organs that are more important than hair.
Mhm. Yeah.
Hair loss, you have to look at the previous 2 to 4 months of your life. Was there stress?
Mhm.
Was that when the weight loss was happening? And we have to pivot to fix that. So it's usually a nutrient protein deficiency with the GLPs, but it's also, hey, what else was going on with the body when we started the GLP? What was your thyroid doing? What was your ferritin level? What's your iron level? And we can usually figure out the cause of it as well. Very rarely is it genetic. And I think like dermatology slaps that on there. The other interesting thing is that there is testing available nowadays that looks at your genetics and tells you which topical or oral medication and nutrients you need. So a lot of us women wait so long or have to, you go to the dermatologist and they give you something that's like part of their algorithm generic protocol that everyone's taking when they walk in the door. And your genetics are going against it. So there's a test for mental health medications that came out. Same thing now for hair loss meds. There's testing available for that can be done to be like, okay, if you're interested in trying something prescription, here's what your body is going to allow, topically or oral. Here's the nutrients it needs. We see women just like you said, they're so down about it and they've been met with such resistance, and then they're on something for 3 to 6 months. It's not working. Try something else. It's not working. The time delay is huge
Yeah.
in this. So we're like, let's look for causes and give you an option if you want to start something prescription in the meantime too. but we're also like, hold up, let's not just necessarily maybe rip the GLP away because it's doing other good things.
Right.
Let's change the dose, the frequency,
Mhm.
the amount you're getting of the GLP too. So long story short, because then what women will do is stop it and then other things start to flare and take
Right.
off too. And it's like, oh my gosh, we also like to wean the GLP or change again the dose and the frequency of it. A lot of women are just on too much,
Mm.
too. And so there's a lot of ways to do that, but it is a major topic. I did put out, yes, a 3-part episode on it too. And hairdressers are the key stakeholders, and like bless the hairdressers because you guys are holding a safe space for us to tell you for the
Mhm.
conversations. You're trying with everything in you to do everything possible to fix it. It's the medical team that's failing the
Well,
patient.
and that's the hard part, right? Because
Yeah.
I've had that conversation too with I can't
Yeah.
legally
Yeah.
diagnose anybody
Yeah.
with
And you're
anything.
like, oh my gosh, like you
I
could, you've
Yeah, I
seen
can
it.
deduce,
Yeah.
but like, and I can make suggestions, but really at the end of the day, and there is no easy solution,
No.
right? I don't have a hair product. I don't
No.
have
There's no
one
hair. Yep.
vitamin
No.
that's going to fix it.
No.
So like, but then they go to their medical professionals and they're like, I don't know what to do,
Here's your
and then
spironolactone, and here's your minoxidil and all that stuff. And
minoxidil.
yeah,
Yeah.
like
Yeah.
by the droves, they've been handed out for, but nothing's ever been done to like actually fix the issue
Right. It's so
that's
much
causing it.
deeper
It's so
than
much
that.
cheaper. Yes.
Yeah.
And
Which
you're
is
allowed to
why,
have those, but it should be
right.
let's look at that. So hopefully we're changing the tables in that space too, because it's a tragedy all over.
Yeah. So if somebody wants that genetic testing, what do
Well,
they
their
go ask
provider
for?
has to be like a distributor, like it has to be a provider with the company that does it too. Find someone who's maybe like, I don't want to say marketing, but specializes in hormones and hair loss. So like
Okay.
hormone people should be doing it too and be looking at that too. I mean, or just, like I don't think a patient can self-order that test yet. So
So what
it's
is
called
the test?
Trico. Trico is the name of the test that we use.
Tricho.
Yeah.
Yeah. Well, I mean, the science of hair loss is trichology. So,
Yeah, like
I
very
mean,
innovative in the name of that. Yeah,
yeah. Right.
it's such a great test too for providers to be using at their disposal too. Like it just makes your treatment so much faster. Day one, they come in, we're offering it. We're not gonna like, let's try this and then maybe do that. It's
Yeah.
boom, right out of the gate, we're doing that and so
Yeah. Yeah. And it's interesting because a lot of the women that I have that are in perimenopause are also doing like that
yeah,
same grouping
yeah.
and age group is the same thing. So I'm sure it's everything you just talked about with the GLP-1s. And then their hormones are out of whack because they're in perimenopause.
And
So
it's always
trying
and
to like
yeah.
find all
Your
of
hair
that.
is not like over here and your uterus over here and your
No.
emotions over here. And it's like, that's why I'm like providers. If I have one tip for like providers, please look at the body as a whole. Like you have to go through
Mhm.
every system every time and be working on every system every time too. Like it's just such a, like, that's what like, okay, touche to the testosterone only clinic, but like you're missing so much by being just testosterone or
Yeah.
just a pellet or just, like it's all
Mhm.
and yeah, that's a whole topic for a different day, but
I know.
it's like,
Maybe we should
and
do a whole other episode on perimenopause.
yeah, we could. Oh God, yeah, perimenopause. Yeah, it's a
It's
whole thing.
It's such a mess right now.
It
So,
is.
you mentioned that maybe doing surgery again, but trying to avoid that. Do
Yeah.
you see any more IVF in your future? Where are
I
you with that?
do, dang it. Like, I will if I have to. Like, is it weird to say, but in your infertility will understand this. Even when you have every diagnosis going against you, like, you're like, well, maybe this month is the month. Maybe if I just change this and do this, maybe I'll get pregnant naturally this month. Like, I don't know that that
Mhm.
goes away. And I just want to, like,
Yeah.
acknowledge that. So, like, I am sitting in that space. Like, but I also am in the space of, opening 2 brand new clinic locations. And so I was in a space of extreme stress. I didn't even have a manager working with me. I've had a godsend of a manager since then to take a lot off my plate. I've learned to say no to things, unfortunately, that I might have like said yes to and being okay with it. I
Mhm.
pulled out of 2 commitments. I said, hey, I have to put myself and my health first.
Mhm.
And I just can't. I said yes to this over a year ago. I'm sorry, I'll help you find a replacement, but I cannot do this anymore. I've had to be okay with that. So I give full permission to anybody who needs permission to say no or pull out of something that's like draining you more than filling your cup. I've had to get really good at delegating in the business. So I think I'm gonna, and then I'm like, girl, take your supplements. I mean, I'm sitting here like with a basket. I haven't touched these in a month. Like they're cute, got some dust on it. For anyone who relates to some dust on the supplements, like I'm just exhausted at the same point of taking 50 supplements. I'd
Girl, that's
rather shoot
real.
myself with a peptide, I'd rather shoot myself with an injection or something just to make it go away at this point.
I still have the supplement PTSD. I
Yeah,
want to get
yeah,
back into just like a basic
basic.
supplement. I saw that you have the, what's
Yeah.
that? The
Primal
packet
Queen,
that's,
probably. Yeah,
yes,
Primal
Primal
Queen.
Queen. I have that sitting in my cabinet
Yeah,
too. Like, I've bought the stuff. I
yeah,
want to do it, but it's been 2.5 years and I still am like, but I don't want to take
yeah,
shit every day.
yeah, yep. I'd rather get an infusion of it or just a shot of it or something at this point. Hey, for anyone like that's developing something, they should make like an injectable vitamin or something that's not an IV infusion, like a
Yeah.
sub-Q or like a drink. Like the drink, I've actually switched to any of them that are powder or drinks and find myself shifting to that. So I have a new one coming. I have we like to use it. We have a couple on our website, companies that I do like and think they're high quality that are powders. So if it's like a powder, I'll just mix it and then take, all the 800 other things with it. But I'm just like, and I also want to acknowledge I'm going through infertility, and I say this a lot to my patients, including those whose husbands are sitting beside them in cups. But I'm like, you know what? Like, people eat McDonald's and do drugs and get pregnant. So, like,
Yeah.
me not taking my damn supplements every day, I'm just not convinced that that's going to be the like ticket holder to it, right?
Yeah.
That's not the issue. That's going to solve it. So I'm like, like, I'm not saying we should do drugs, but I am just saying give yourself some permission to
Yeah.
like lay off of some of this stuff. Enjoy, when people take vacations for a break, I'm like, please eat and be merry and do drink,
Mhm.
have the wine, enjoy that if that's your thing. I just I'm not, all my IVF doctors let me drink. I love high quality, red wine. That's like a passion of mine, we'll call it. I don't drink it hardly ever. And I think there's like also this, don't need to quit drinking to get pregnant. It's like, I mean, if you have a drinking problem,
Yeah.
sure. But like, they let me drink the whole time red wine, both doctors, both different times and stages of my life. And I was like, you're not going to convince me that cutting alcohol completely, cutting caffeine completely, restrictive life things
Mhm.
it's going to get me pregnant either. So I've really had to work through a lot of that too and like clear my head of that a little bit too, that I can still have fun, not killing my chances. And I'm still just trying to find, I think diagnosing women earlier is where I'm at.
Mhm.
Teens, we've really made a big movement into the teen space, and you're going to get the endometriosis and PCOS diagnosis earlier. We're going to work on that earlier in life so that when you are ready to start a family, it's not a problem then. That's where
Yeah.
I think a lot of this sits, is if someone would have caught this when I was in their room when I was a sophomore in college, this would have been a whole different story than when I'm at, 30 and 40 trying to have a child. So
I
I'm really
mean,
trying to move the needle.
they put me on birth control when I was like 13 years old. I was not having sex. It was
100%. Like,
because
absolutely not. Like, we're just like, if the teen wants that in our office and the mom and they've made that decision, great. But there is a huge movement away from that. And that is like an option, not the only option. And that's what we're
yeah,
seeing presented, is that this is the only option. No, it's not. There is
yeah,
lots of other things we can do to help regulate your symptoms that does not involve birth control. Like,
yeah,
just not gonna, it's there if we need it, but it's not the only option. And we have to stop making it the only option.
yeah. It's wild. I mean,
What a
it's
wild time to be a
crazy.
female.
Right.
It's like, what a wild time.
I know. I mean, I was talking to my mother-in-law recently about the perimenopause stuff because she's 70 and so she's been through menopause,
Oh,
all of it.
yeah.
But she was like, "Well, I didn't have to take anything." And I was like,
Woo! We
"Kayla,
could have a whole episode on that. She should be on something though for her health, for cardiovascular protection, mind, bones, prevention, like that. And there's a big shift we need to make on like, you didn't go through menopause. You don't just go through that either. Like, and that's what
well,
women are
and
also.
I do think you can let me know your medical opinion on this,
Yeah.
but I do think that because she's an older generation, she wasn't exposed to all the shit that we've been exposed to as much.
Like from a environmental piece of
Yes.
it too. Oh yeah, I
Hmm.
think environment is definitely a piece of it too. Like for sure. I mean, I watched the Netflix doc. I'm into docs now, right? Documentaries. What's it called? The plastic one. Plastic
I
detox.
can't bring myself to watch it because I know it's
I
just
didn't.
going to
Okay,
depress me.
warning. I had no clue it was going to involve infertility, so here I am
Mm,
crying through. I'm thinking I'm going to go in and just like learn. It's actually so good. It's so good. I haven't. I knew going into. I wasn't going to like go and change 50 things. But what it showed to me is environment and things that have
mhm,
changed from the 70s and 80s are definitely
mhm,
impacting our fertility. So it did prove that to me. Love the main lady and love a lot of things about it. And but I did not know it was all infertility. So warning, it's all
mm,
about infertility stuff too. Like I just wasn't ready for that. I was like, crying.
yeah.
But I did make some changes, right? And I use glass, in the house. I'm about to throw away any black, spatula
Oh,
and stuff
yeah.
like that too. There's takeout containers. Oh,
Hmm.
snap. Nope, we share food now, so we don't have takeout. They all like are containers. I did not realize how much those
Mm.
things, those are little. I'd be the weirdo probably at this point. I'd probably just bring my own to-go container if I'm gonna like take it home
Yeah,
and bring
I
my own
mean,
glass.
people do that. Yeah.
Yeah, those are like little big things. Put it that way. That
Mhm.
I think I'm willing to make that change. Why not? Like, there's enough proof there. So yeah, little big
Yeah.
things.
Yeah, I mean, so that's what I had said to her. I was like, well, okay, I was exposed to a lot more processed foods, a lot more plastics, a lot more endocrine disruptors,
Mhm.
and I think just things, and the science has changed too, and the knowledge has changed,
It
because
has.
she went through it probably 20 years ago or more.
Right.
So,
And I don't want to like compare either, but like we are also constantly being inundated. Like our cortisol levels are just naturally through the roof as a female in the
mm,
last like 5 to 10 years too, with like notifications and social media. Like it's just constant, like ding, 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 ding. And
mhm.
we're like entrepreneurial women more than ever before too, and putting
Yeah.
our careers first nowadays and wanting to delay fertility while going against all the odds of that stuff too. So there's just a lot. Like I also didn't know my mom worked part-time back in the day. I was like, "Oh, you did? I thought you worked full-time." Like, interesting. I work like
Interesting. Yeah.
the level of 5 women probably back in the 80s now. So, like, I know not like I don't need a badge, but that's just where I'm at,
Yeah.
and I enjoy it most days, but, like, that's not my nervous system doesn't get a chance to kinda come down,
Hmm.
and I'm learning more about that as a patient myself too and how to
Hmm.
regulate my nervous system more too. So, stay tuned, I'm just keep using
Yeah.
myself as an experiment.
Yeah. So maybe IVF in the future then? It's kind of
Yes,
on your
definitely.
mind?
Yeah, yeah,
Mhm.
definitely. And I am one that will share the whole darn thing as I'm going through it too. Like, why not? Like, I'm
Mhm.
gonna be totally open. If I have to, if nothing's happening the next 6 months, I have kind of by November, December, I will start, going down that road again. So for
Okay.
sure. Yeah, I
Alright.
want to.
Yeah.
I
Yeah,
don't
it's
want
so
to, but I
hard. I
will.
mean,
Yeah.
I definitely go between, when I walked away from it 2.5 years ago, I was like, I'm done. I can't handle the heartbreak anymore. And I genuinely still believe that. But every once in a while, man, I'm like, maybe I could do it again.
Maybe just, maybe you should come with me and do the whole ovarian rejuvenation thing. Let's go do it together and like just see how if nothing else, we're using it too for hormone regulation. So if you look into
Mm,
ovarian rejuvenation for really bad, not really bad, but like just hormone regulation, there's a
mhm,
lot out there on how it helps, slow balance or make you feel. They're doing it on menopausal women.
mm.
I learned through this process you have 1,000 dormant eggs. I don't know if it's per ovary one. I don't know. 1,000 dormant eggs when you go into menopause, and you like can kind of reactivate them essentially too. So yeah, I'm
That's
like,
with the
oh,
stem cell stuff?
yeah, stem cell stuff. So ovarian rejuvenation stem cells. I think that's where we're at with fertility. It needs to be like fast tracked. And I'm just like, you just send me. I'll do it. Like I'll just try it. It's
I
not gonna
know.
hurt me.
Oh,
Yeah.
man. So, the other thing I saw on your social media the other day was you are filming a documentary. So,
Yes, I
tell
am.
me about that.
I am. So Tara being Tara, like, just, it's either black and white or not at all. But I'm like, if I'm going to go through this again, I want to film this, but also, oh my goodness, women's healthcare, like
Mhm,
the medical gaslighting, the disaster of women's healthcare that is sitting in the healthcare space and the patient stories and experiences that I saw, I was like, this needs to be filmed and documented, and a book can't capture this. Like, I had a
Yeah.
book on medical gaslighting, and I'm just like, no, this doesn't even touch it. I need to like give these women a voice. Many are willing to share, but it starts in the teens year. Like, I can't tell you how many teen girls were told like, oh, you can't diagnose anything when you're a teenager. You're still developing. Or again, here's your birth control only for your symptoms. And the mental health that sits in the teen girl space, the postpartum mess, the infertility, the perimenopause, the menopause, like the disaster that sits in there is going to be revealed. And so I'm just really excited too. And it's kind of pivoted into sharing a little bit more about like my entrepreneurial journey and my IVF journey, my endometriosis journey as well. But I'm excited to share like the growth of a clinic that's going to also show how I'm completely changing what healthcare
Mhm.
looks, feels, smells. It's like a sensory change that's about to happen too in the healthcare space. It does not need to be cold, crusty, smelly, sterile. Ugh. Like, no. So I'm sharing that piece of it as well, and really just hoping to give women a voice to share, their story too, and what healthcare can look like, and hopefully helping change research and funding behind what women's health has as well. So
I
yes.
mean, I recently heard too that, like, because insurance only covers certain testing at certain
I'm
times of
glad you
your
said that.
life,
Yep.
like, I listened to a podcast about breast cancer one time, and they're like, "Oh, it's so treatable nowadays, but the women that are dying from it are women who didn't get diagnosed in their 20s and 30s because insurance doesn't pay for a mammogram until you're 40.
Yes.
So then they're catching it too late on these younger women, and it just like none of it
Yep.
makes any sense, and it's so
Yep.
frustrating."
Yeah, I'm glad you brought that up. So what happened on day one of filming actually came forward was a part where I got very, we'll just say, emotional about insurance as a small business owner with a private clinic and being a patient and seeing what patients experience. So I am the weirdo who takes insurance. That is so, from an entrepreneurial point, not looked at as a good thing. But why not? Like, patients should get to use their insurance. I will tell you why not. It is a disaster. It is a
Mm,
disaster as a small business owner to take it because insurance companies make it very hard to get reimbursed, very low to get reimbursed. I've had to
mhm,
cut some out because of it, because they will not negotiate with me.
mhm.
It is a lot of healthcare issues sit in the insurance hand, and that's been exposed on social media a lot lately too, with providers calling out these prior authorizations and these approvals that have to get made by some man or woman sitting on a phone, not even working in that space, saying yes or no to a screen, to a surgery that's needed and necessary. We are allowing insurance companies to have too much of a say in what is approved and what's not approved. And it should be the doctor and patient have that conversation.
Mhm,
And so
mhm.
I've also found a nice way, we'll say, like, I try everything possible to get insurance companies to cover medications or find a way to make it cheaper. And using these compound pharmacies and local pharmacies, we've teamed up a lot to make pricing cheaper together for medications that aren't covered specifically for women. We'll use like testosterone, for example. We
Mhm.
found a way to make that more affordable. Progesterone, things that aren't covered by insurance, and exposing that too. So there'll be exposure of all of that in there as well.
Yeah, I mean, it's and plus, like, the climbing premiums on top of
Oh
that
my
too,
gosh.
like
It's what point, how high can it go before like we've hit it? We've hit the
yeah.
ceiling where is it really worth? I've had patients is not even worth having insurance for what you're
No.
paying per month and what your deductible is. You might as
Mhm.
well cash pay.
Yeah, I mean, we kinda did something like that this year because we were looking at on the exchange in Colorado, we were looking at $1,000 a month for the 2 of
Yep.
us,
That's where we're at. 1200
and
for two of us. Yep.
high deductible, and we
5,000 plus deductible.
yeah,
Yep.
so we just did a supplemental situation through my husband's work, and it's like 500 a month instead. And, like the working middle class is eventually not going to be able to afford any of this stuff. And
We're
then it's
there.
going to be a
Yep.
forced government paid
It
for
is.
system because people just aren't going to pay their bills.
Yeah, we're
Too.
at the point where something has got to get figured out
Hmm.
ASAP about this because it is and for employer security that is not feasible either anymore. That is
Yeah.
a
Yeah.
huge expense that is going to kill small businesses.
Yeah.
So like I know how to fix all of this. Again, holler government or insurance company is like my local one of my local insurance companies is like worked with me and talked with me, and they're like, because I get audited because we
Mm,
do bill on time. I spend more time with them. I should get paid more. But the
mhm.
issue, like as a nurse practitioner owned business, federally, we get 85% to what an MD gets. So my reimbursement is automatically lower, even though I'm doing the same thing and better
Mm,
than most,
mhm.
doctors
Yes.
in the healthcare system. I get reimbursed less. So I've had to find this way to also own a small business, keep it affordable, keep costs down, but really change how that is too. So it's a very cool, not cool, stressful and cool entrepreneurial journey that I've embarked upon too. That'll
Yeah,
hopefully be shown in there a little bit as well.
that's super interesting. Yeah. Well, this is gonna be such a great documentary. I mean, do you have, I know you're trying to get people to pick it up, but
Yeah.
like, do you have a time you'd like to have it finished and ready to go by? Or is
Yeah,
it gonna
I'm
be
hoping in the
months?
next year, like in the
Okay.
next year to have it done because I want to, the patient stories are going to be so unique and kind of follow them through their journey a little bit too in their personal side and get to see that personal side of their stories at home, out in activities and things that they're involved in too. I really want to highlight how health impacts a patient from the time they wake up to the time they go to bed to relationships to jobs to school,
Mhm.
work, organizational, apparent, not apparent yet, like just how it really every piece impacts them too and really show that because my overall message has always been women, we have to start putting ourselves first again. And by first, I mean our health because so many women put everybody and everything first and your tank is on empty and we cannot be sitting on empty anymore. And it's really going to show, I hope, how we can maybe empower young teen girls to have a different.
Yeah. Yeah. I mean, it's so important. We're just so socially conditioned to put everybody first and our
Yep.
children first and our
Yep.
families first and our husbands first. And like ours
Everybody.
has
And like it's
always been on
bad.
the back burner.
Yeah, we're back, and now we have, cancer rates that are higher, mental health rates that are climbing. Like it's just not okay anymore to do that without having some sort of balance and care for ourselves built in there too.
Yeah. Crazy. I
Yeah.
mean, it's a wild world out there that
It
you
is
jump
wild. I
into.
know. And, like, I have to say too, if someone told me, "Well, just slow down and pull back a little bit," I'd probably throat punch you because that's not the answer. That is not the treatment, that is not the answer. I like thriving here as an entrepreneur. Like, don't I know I need to, like, say no to some things, I've got better about that, but to, like, tell a female just, like, overnight to pull back on their load, personally, professionally, is not the answer. So there's things that
So
we need to do to help with that.
my very first egg retrieval that I did, the nurse that called me to tell me my final blastocyst results of that retrieval, because we had 11 fertilized and we went down to 2 day 5 blastocysts. And she literally, in the voicemail that she was leaving me about that, said, I think I saw somewhere that you're a hairdresser, so that might be contributing to this. Like,
Yes.
literally,
Yeah.
I'm like, oh,
Yeah.
great. Let me just quit the career I've been doing for 15 years at that point that has
For
been
fertility.
paying for this
Yes.
because you think the
Yes.
chemicals are affecting me, and they probably are. But like,
That's not the answer. Not the answer or solution. And that's not the treatment either. That is not the
yeah.
treatment and the solution, the diagnoses. Like that's
Also,
not it.
blame me. Thank
Yeah,
you for
and
that.
then, I already felt bad enough the way it is for failure of family. Like, let's just throw the career under the bus too. No, that's where the verbiage needs to stop as well. And I've also been very particular. I think I've got it down track too with training my staff if they haven't been through infertility, finding the right people to work in these spaces
Yes.
too, and not just hiring somebody in the fertility space just because. Like, very cautious and taking action when that happens because that is not okay when that stuff
Yeah.
occurs.
Yeah. Well, there's your gaslighting,
There
right?
it
Like,
is.
it,
That's one of 1,000 probably gaslighting incidences you've
yeah.
had.
And I didn't even ask. That was in a
Yeah, like, I
voicemail.
didn't ask for your opinion, but thank you for leaving it here anyway.
Yes. Anyways. All right, my friend. Well, this has been lovely. I wish we could just talk for hours.
Hey, I'll just come back. We'll just keep everyone updated on here and
Yeah,
socials.
I would love that. And I really do think that, especially with the phase of life I'm into, like learning more about perimenopause and menopause, I think would be super helpful. So maybe, sometime in
Yeah.
your busy schedule, we could do
Tap
this
back in.
again. But thank you so much for coming on and giving the update.
You're
I'm
welcome.
so excited. Literally, if anybody is struggling with anything we talked about on here,
Come
contact
say
Tara.
hi to me
Where?
on Instagram. My inbox is open. Come say hi. I'm there.
Okay. And what is So I think I had your old clinic name. What is the name of your clinic now?
Simply You Wellness is
It
my
is
clinic.
okay.
Yep, Simply You Wellness, and then my handles are Dr. Tara Harding. Yep,
Yeah.
and
So
all the
definitely
things.
contact her. All right. Do you have any parting words for my listeners before we go?
No, I think it's just, put yourself first again. You deserve this. Like, this is make this a year of you. And that sounds so cheesy, but whatever that means. And it's okay to say no.
Mm,
It
mm,
is okay to say no to things that are not filling your cup anymore.
that's so important.
Yep. Say no. Just say no. Like bring back the dare thing again, Like whatever. Like we're gonna put it in because all the dare kids are like perimenopause, now. So like it's just say no again to things that don't fill your cup and drugs, of course. But
I suppose.
I suppose only the bad ones.
Yes. All right, my dear. Well, thank you
Thank
so
you.
much for
Yes.
coming on and updating us. And I'll be looking forward to more updates and hearing about your documentary
Yes.
and all the things. But seriously, everyone, contact Tara. She's amazing. So
Thank you.
thank you, everyone, for listening. And we'll see you on the next episode.